This podcast episode is sponsored by Microbalance Health Products. For over 20 years, Microbalance has been formulating and offering non-toxic and environmental cleaning products, homeopathic formulas, and professional-grade supplements to help people recover their homes and their health from mold toxicity. Visit microbalancehealthproducts.com to learn more and shop.
Welcome to the Modern Day Naturopath podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back. This is the Modern Day Naturopath podcast. I'm so excited to have Dr. Sparks back on. Welcome, Dr. Sparks.
Thank you. Nice to be here.
So happy to have you here. If you've been listening to our podcast, we have a foundational mold podcast that we have done, so you can check back for that. And today, for those of you who do not know Dr. Sparks, she is a naturopathic physician. We graduated from the same naturopathic medical school in Tempe, Arizona. She also got her degree as an acupuncturist, as well as has a master's in Chinese medicine. She joined Naturally Sue Wellness probably, 5 years ago, maybe more. Wow.
Yeah.
5 years ago. We've been so happy to have her. You can press pause and follow her on Instagram. Her handle is Dr. Sparks ND, DRSBARKSND. So thank you again for being here.
Thank you for having me.
Of course. I would love to first start off, before we talk about the subject today that we thought was important of mold colonization and what that actually means and how that can affect people's health. We thought, in case you didn't get to listen to that podcast, to have some context about mold illness, if maybe we can go over some really important key notes about mold illness. So if you were to meet someone who's never really heard about mold illness or what mycotoxin illness means, or even symptoms associated, could you give us a little overview so that the audience can at least have some context if they didn't get to hear that podcast?
Yeah, I would say to start, there's a big difference between mold illness and mold allergies. And so we'll get into that more later. But mold allergies are, you inhale a spore and then you kind of have an allergic reaction or something with your respiratory system. Whereas mycotoxin illness can get in and get to every single organ system in the body, because mycotoxins are 1/100th the size of mold spores. So they're much smaller. And they're basically, so mold spores are the fruiting body, so the fungus will send it out to create more colonies in other places. And then mycotoxins are actually what we call like chemical warfare. So when there's another fungus or a bacterial colony kind of invading its space and trying to eat its food, it will send out these chemicals to try and kill them off. In the meanwhile, as humans, we're inhaling them, getting them through our skin, getting them in our food, and then, it's affecting us at a cellular level.
Wow, that's so interesting. What was that? I wanted you to repeat that fact again. You said that mycotoxins are what size?
They're like, I think they're 0.1 microns, so they're 1/100th of a size of a spore. And you can't even see a spore without a microscope.
That's probably why you don't smell necessarily mold in the home, is because they're that small, or does that have anything to do with that?
I think they're just a different chemical compound.
Okay.
Yeah.
Okay.
So that's a good point though. Like people say, oh, well, I don't smell anything, right? But the mold could be behind your wall, and so the spores can't get through, but the mycotoxins can, and they don't smell. So you could still have mold illness without smelling mold. So that's very important.
Yeah, I hear this all the time. And we just had a conversation just yesterday. We were discussing a patient case because we do collaborate on a lot of patients where we both put our expertise in. And since Dr. Sparks was certified recently over the past, year-ish?
2 years.
2 years. Wow. Yeah. By Dr. Jill Krista. We now have her in my practice as this mold expert, and we collaborate on cases. And we were talking yesterday about how, there are patients who tell us, no, there's no way I've been exposed. There's nothing in my house. And we've asked them, and we have this intuition because as practitioners, not only are we using like science, we're also very intuitive and, this sounds like this, and or hey, I've seen something look exactly like this from another patient in the past. And so until we test their mold markers, all of a sudden they have these like huge aha moments that they're like, "Oh yeah, did I tell you that I don't know, I have black mold here, but oh, that is that a big deal?" Like it's like they don't think it's important, or it's like the patient. It's like reminds me of my patients who are like, "Oh yeah, I have like 16 tick bites. Is that a big deal?" I'm like, "Yeah, it's a big deal."
It's a big deal. Yeah,
Right?
and
Because
then
they like
they'll
smell
and
it, and you're like, "What's it?"
yeah, it's not until they get their mycotoxin test back and they have all these mycotoxins that they'll go, "Oh, so, like, that black stuff in my bathroom, I probably shouldn't have that there, right?" Yeah, no. No, yeah, you shouldn't.
You should you shouldn't. And it's sometimes at that moment, they're like, "Wow." But I think when you just lived a certain way and no one's talked about it being a problem, you're like, "Oh, this is just normal." Or, "Oh, that damp, musty smell in my basement, it's just normal because that's what basements smell like." Right? Or that's what
Well,
I had,
that's
right? Someone just literally said to me when I said I could smell mold in the space, he said, "No, that's just what Florida smells like." And I said, "No, that's what moldy, apartments in Florida smell like, right?
yeah,
That
yeah.
can cause significant issues."
Yeah. Well, and that's a good example because when I was living in North Carolina, I had a place that I was living at in the basement. She told me, "Oh, you can't keep your bicycle down there because it floods all the time." Well, I didn't think anything about it. I didn't know anything about mold back then. And then I started getting hives, but I wasn't having allergies because there was no spores, just the mycotoxins.
Okay, and that
And
you
the
actually
other thing
talked to
is,
her about, right?
yeah, you might be ill from it as well, and then other illnesses that you have like latent EBV or Lyme or other things, GI issues, like they get exacerbated by mycotoxin illness.
Absolutely. So can you talk just a little bit more about that and the type of patients that we usually see come through our practice, that it's not always just mold, and kind of what does a mold, when we call them a mold patient, just for lack of better words, but what does someone like that clinically present, and what other issues do you see them having?
Well, I would say the number one issue with mold illness is fatigue, and kind of unexplained fatigue, where we're like, okay, you don't have anemia, your adrenals are fine, your thyroid's fine, like what's going on here? You don't have EBV. Mold, right? Then brain fog is another big one. Sinus congestion that like never goes away. GI issues that, especially when, see, this is the other thing is, again, people will say like, oh yeah, I don't think I've been exposed to mold. So then we're kind of following the path that they lay out for us with their intake, right? So they have a GI issue. So we're like, okay, we'll run a GI stool test, right? And then we start working on that. Things get a little bit better, things are good, couple months later they're back at it. It's like, well, what's going on? Mold, you know. So a lot of times I would say it's more things that should heal that don't heal. You know what I
Right.
mean?
Absolutely. I just said that to someone yesterday because I said when nothing else is working, it's usually like in my experience, even if we do foundations that will of course move the needle a little bit, usually the things that I see that it's like you're either in that moldy environment doing, no precautions to get better, no air filtration, no like the microbalance laundry additive, or nothing to like help spores on your clothes, like basically doing nothing. And or I see a lot of patients with now, the more that the more that I learn about Ehlers Danlos and hypermobility, I'm seeing those patients too because they're kind of like this mast cell chronic fatigue picture, and it's almost intertwining a little bit. So I just said to a patient yesterday, when we're doing all the things right that we'd assume move the needle the most, and it's not moving, could it be this genetic hypermobility, or could it be mold? And right, could it be those things that people are not thinking of, especially when they go to a conventional doctor?
Yeah, or, think of go to a conventional doctor and they tell them it's not a thing, you know.
Exactly.
Or, then they're told it's not a thing, and then usually it's only one or two people in a family, so then the rest of the family thinks it's in their head. It's
Yep.
not in your head.
And then they
Um
feel then they feel crazy, and then they doubt themselves, and then that makes them feel even sicker.
yeah. And then another big thing is like, you move into a different place or you start a new job or, and then you've been healthy for a long time and now you're sick. We're going to, environmental stuff is what we're going to look at. Another thing is I've been able to eat anything I want my whole life, and then all of a sudden, like yesterday, from now on I can never have this food, you know. That's another big one.
That's so interesting. I never thought of that with a patient with mold. So they have this just rapid turnaround, you're saying, with foods were fine and now foods are not fine. That's super interesting. I didn't see that in my patients. Like I didn't know that actually. Thank you for
Ah,
sharing
okay.
that.
Yeah, well, it actually even happened to me back when I had mold illness. I couldn't eat anything with sulfur in it. So, here I am, newly graduated from naturopathic medical school. I can't have like kale, broccoli, onion, garlic, you know what I mean? And it was because I had a gliotoxin burden, you know? So, yeah, it's
That's super
crazy.
interesting. So when you said I have a gliotoxin, speak now a little bit about how do you know, like what do we do to test patients? What are their options? Can they get blood work? Can they get urine tests? What are your go-tos for mold testing in patients to test their body, right? And then we'll talk about, of course, how we can find it in their home that we even know it's something that we need to work on.
Yeah, so I'd say, excuse me, one of our main things that we do is the Vibrant America mycotoxin test. And they test a lot of mycotoxins. So that's going to show you how much you can get out of the urine. So that's another thing. If someone's a poor excreter, you could have a false negative, right? So that's the only kind of issue there. So you could do something like my mycolabs that tests blood for antibodies to mycotoxins, so you're not limited in that way. There are also other mold markers that you know about, right? That or immune markers, let's say, that could show us, hey, there might be a mold thing here, like TGFB and C4A. Um, and then, did you want to talk a little bit about the nasal swabbing?
Yeah, so there's this company, and I'm by no means an expert in nasal swabbing, but I do it to help patients figure out what's going on in their sinus cavity. So years ago, the reason I learned about this is because of my Lyme journey. At that time, I've met all of these other Lymies, as we call them, in the centers that we were going to get our IVs and all of our naturopathic stuff that we were doing to heal. And everyone was doing nasal swabs and wanting to know if they had something called Marcons. And within the nasal swab testing, it tests for Marcons, which is multiple antibiotic resistant Staph aureus. And it, or is it, yeah, I think it's Staph aureus. And then they also, which is a bacteria, as well as it checks for fungus. And it also checks to see biofilm, and it will tell you how big the biofilm is. So you basically just take this nasal swab, you just put it in your nasal cavity. That's really it. And then, yeah. And
It's
then
got to go up
you
there.
it gotta go up there and you send it in and they tell you, is there bacteria or is there fungus? Why is that important? Because then you'd know what to treat. Because how many patients are end up on antibiotics? I just had a patient just this week, super stressed out because the antibiotic didn't work for her sinus issue. And then we find out that her doctor, thankfully, who is a functional medicine doctor, gave her a nasal swab and it said there was no bacteria. And she was about to take a second antibiotic. So now we're doing this test to be able to determine if there is fungus there. So in the meantime, that's when, and we can talk about like what I told her for sinus type work, but to do some things to help in the meantime. But one other thing to just mention is a lot of Lyme and mold patients, because their immune system is down, they end up with Marcons. So it is antibiotic resistant. And Marcons, from my research about it, and again, I'm not an expert, but it can cause systemic symptoms of chronic fatigue, ongoing sinus issues. It really puts a huge burden on the immune system. So the patients that, or the friends of mine I met at those Lyme centers, they all had Marcons and they all got these designated, there were like nasal sprays that were compounded with certain things to help. But of course, you can use some of the other products we're going to mention uh, later on in the podcast. But just something to think about if you've been having ongoing sinus issues and you're not knowing, do I really need that antibiotic? I just like Jetta had a patient yesterday who did a CT scan and it just shows inflammation, but they're like, I don't see an infection. But then she told me she had black mold she saw in her washing machine 2 days
Oh,
before
that's a
that.
big place. Yeah.
So I was like, okay, maybe obviously, why are we going to, if we need an antibiotic in crisis care, we use antibiotic in crisis care. But if you actually don't even have bacteria, why are we doing that if it's fungus or mold? It just doesn't, right? Make sense.
Well, and on top of it, not only is it not effective against the thing that you actually do have, it's also hurting
Right.
your microbiome. So your
Exactly.
natural flora are taking a hit. Like,
Exactly.
and
Exactly.
also remember that not you, but everybody else, that our sinuses are holes in the bone. So there's not a lot of blood innervation there. So it's hard to get an oral antibiotic to work in a bone hole. So that's where sprays come in. Yeah.
That is very true. And also, can you talk a little bit about if a patient can't, let's just say, afford $1,000 for a mold inspector to come in, what's a good way to start screening, in your opinion? I, of course, like those screening kits by Microbalance, the test kits, but can you talk more if you also utilize those with your patients? I know we had a shared patient who, thankfully, we used those and it changed her life, right? They
Yeah,
ended
she
up
ended up moving
moving,
out.
right? Yeah. Can you share more about that?
Yeah, so the test plates, they're kind of the test plates that we used in microbiology lab, you remember? So basically the spores, yeah, there you go. There's a nice picture for the people that can see it. They basically, you leave it open for a certain amount of time. I think it's about an hour, and spores are always floating around in our air. So there is a certain amount of fungal presentation that you're going to have in your home. And so they land on the plate, then you close them up, and then you let them grow for about 4 days. And then you look and you say, okay, do I have colonies? It's also good to tape them, because you don't want to open that and be like, oh, here's all the spores. So keep them closed, people. Don't open them. And if you get more than 4 colonies, which is like a little growth spot, then they're saying like most likely you have an issue. 4 and less is normal. So people always say, well, isn't it normal to have? Yeah, it is normal to have a small amount of mold, but when you start getting 5, 6, or like a giant plate that looks like a sweater, it's like, no, like we've seen those. People have sent us those plates,
They look
like the
like
pictures.
knitted sweaters like you get from your grandmother. There's like gray and blue and black, and it looks like a myriad of just like colors. And I'm horrified when I see it. And then I find out that they opened it into their home just because they wanted to
Yeah,
see it. And I was like,
tape
no,
it.
please.
Yeah, tape it. And the other thing is, a reminder that the plate itself, the food on it, doesn't grow every type of bacteria, I mean fungus out there. So you can have false negatives, but it's a place to start. I mean, you don't have false positives. Like if it's growing, it's growing.
Exactly. And they
You
even
know.
said that if you, we talked about this a little bit in the last podcast, if you have a really humid environment, it can pull the spores down. So it's not going to be in the air. So I had a patient, this is why it's important to use clinical judgment and not just tests, because if the patient's not, it's like the same thing with Lyme. I wouldn't have known I had Lyme if I just depended on a test, right? It just, if you hear the patient has mold symptoms, There was a patient who literally said, I don't think it's in my house, but he screamed mold illness and his brain was on fire. And the ladies who I absolutely adore at Microbalance, Catherine and Nicole, they said, hey, I need you to actually test his, like, keep looking for it because I'm not convinced it's not in his house. So they told us to do different things like tap the upholstery or like the carpet or things like that to see if it came down. So they basically say do like tap tests. So you tap it on there. And sure enough, he did a few of the methods that they said, and it was true that he did have high humidity. And then when he tested something, it looked like your grandma's sweater. It was pretty, it was pretty bad.
Yeah.
And I love using microbalance test plates for patients who have symptoms of mold illness and want a simple way to screen for mold exposure in their environment. These plates are affordable and each pack includes 6, allowing you to test multiple areas of your home, even upholstery and carpets. One of the best things about microbalance test plates is that they don't produce false positives, giving you clear, reliable results. Knowing if mold is present in your space can help guide your next steps, whether that's scheduling a professional inspection, remediation, or creating a targeted health plan to support recovery from mycotoxin illness. So many of our patients have used these test plates, and the insights they've provided have been life changing. When you know what you're dealing with, you can take the right steps toward healing. So, I want to talk a little bit more about colonization.
Mm.
What is colonization? I know they talk about it in the sinus cavity or the gut. So before we talk about how mold can colonize in sinus and gut, what exactly does that mean?
So, um, it's basically, spores and mycotoxins. We talked about those before. Spores will go in and create little colonies, right? Like those little things that you're seeing on your plates. They like to grow in the body too. It's nice and warm. It's plenty of food for it to eat. So they're growing. Now, remember, you have bacteria, virus, fungi in and on you your whole life. Like that's just the way it goes. The problem is when it becomes pathogenic. And usually, we all have biofilms. For example, do you ever feel a fuzzy sweater on your teeth? That's a biofilm. Um, like when gotta brush your teeth. So that's just a good example of a biofilm that we've known about for like 30, 40 years. And now we're getting more and more data on biofilms in other places in the body. And the sinuses, like we said before, because it's in a bone hole, it's a good place to, it's dark, it's damp, hard to get to with antibiotics. So it's a great place to grow that. And then also in the gut, a lot of times you'll have a biofilm from bacteria, from good and or bad bacteria, yeast. I'm trying to think of other things that can kind of create these biofilms. And then what happens is it's really the insult of the mycotoxins that makes it, it kind of changes the way your flora works in your body when you're being attacked by mycotoxins. So then it kind of turns this maybe possibly inert biofilm into kind of evil biofilm, I guess is a way to say it. And so then you could have had, exposure to mold and have some colonies and biofilms in your sinuses without a problem, but then you get exposed to mycotoxins and it's kind of supercharging that. And then also at the same time, you're getting immune dysregulation, right? So you're not even having like a good way to fight these things off. And then people who have definitely been exposed in water damaged buildings, they're like, we know that that's most likely happening to them. So we're kind of fighting that the entire time that we're working on mold illness, because then say we don't work on the sinuses or biofilms, and then we think, oh, okay, well, they're retest, they're coming back okay, their symptoms are better, okay, they're good, and then they go to a hotel, they get exposed to a mycotoxin, and it's all hell's breaking loose, and they're like, but I was only exposed for like a few minutes. Well, you also have kind of this thing inside that's been there and is just kind of reappearing. Does that make sense?
Okay, so let me make sure I understand this, especially for people who have never heard this before. Could we technically use the word colonization and biofilm interchangeably?
Uh, yes and no. I would say if you have a biofilm, it's colonization, but colonization doesn't always mean biofilm.
That makes sense.
Does
And
that make sense?
yeah, and for also people who have never heard of this before, just we could say that just think about these organisms want to live and they just create this nice environment to be, or they basically, the biofilm is protecting them from being killed by the immune system. That's usually how I share it. I want to know if you agree with that concept, because it's just like Lyme organisms or any other organisms, they want to live, like you said. It's really enjoyable to be in our body. There's nice spaces, they can get nourished. It's nice and, you know, it's nice and yummy there. So they don't want to die from the immune system. So they create this biofilm around them. And that's why people get better, even just Lyme patients. And I say Lyme a lot here because most of our patients who have mold also have Lyme and vice versa. And because when they are exposed to mold, it can reactivate that a dormant Lyme infection, even if they've never had Lyme symptoms in their life, right? So that's why I keep bringing it up, because most of our patients, at least the ones that I have, it's always this combination of Lyme and mold. I have less of just mold. So you may have a little bit more of just mold. But with those biofilms, they can create biofilms anywhere in the body. And right, like even just yesterday, I was talking to a patient about like interstitial cystitis and biofilms with, right, this mold and Bartonella. So just think of it as like, how can the organism survive the immune system? So it creates this nice, home for it. And we want to, of course, break down those biofilms, but that's where it comes into the art of medicine. Because if you give someone a biofilm buster right away at the start of treatment, they will probably never come back
They will
because
hate you. Yeah.
think about it, you're just, like, busting the film around the bacteria or the fungus, and now it's just, like, rampant around the body, and if there's no actual way for the organisms to come out, if their pathways are not open, if their elimination is not good, if they're not methylating, just imagine, right, all this storm of what's going on.
Yeah. I mean, that can happen too, I would say to a lesser degree when you're doing it in a good way and you're not doing it right away. But yeah, if you do it right away. And I've had people come to me and just say, like, yeah, I was at this, went to this doctor, whether it was naturopath or functional doctor or whatever, and they gave me this biofilm buster and a binder. And that was like, and I'm like, ugh, you know, and that's why, obviously, why they didn't keep going there. But
Absolutely.
yeah. Um, the other thing is, I would say like the three. Now that you're talking about interstitial cystitis, I would say four places that we see these things the most would be in the sinuses, in the GI, in the lungs, and in the bladder. And also remember when mycotoxins are coming through the liver, and then some are going out through the bile and the bowel movements, and then some are going out through the urine. If you hold your urine, they're just hanging out in your bladder, causing inflammation in your bladder. So interstitial cystitis people, I tend to think either like food intolerances or mold.
That's such a good point. How many people are holding the amount of people listening to this right now, and they're gonna go to the bathroom, like pressing pause. Everyone doesn't go to the bathroom when they have to go to the bathroom. I don't know what it is. I don't know if it's how many people say to me, "Well, yeah, I don't have my body weight in ounces of water because then I'll have to pee." I'm like, "Well,
Okay, go
yeah,
do that.
that's
Then you get your steps in for the day.
I know. I'm like, yeah, but that's how we have to stay hydrated. Remember, I don't know if you've seen, there's a medical doctor who wrote a book, You're Not Sick, You're Thirsty.
Oh, I haven't read
It's
that.
like,
No.
I didn't read it, but that's the name of the book. Because think about the amount of things just from dehydration. But if people are not drinking because they don't want to pee, and then when they have to pee, they don't pee.
Well, then also think about it. If you're not drinking a lot and you're holding onto your urine, you're doing both, right? Well, then you have concentrated mycotoxins in your bladder. And you're way
That's
more likely to have interstitial cystitis.
That's so true. I'm so happy you brought that up. So if you have to go to the
Yeah.
bathroom, go to the bathroom and then make sure you're hydrated. I can understand the people, they'll be like, "Hey, I have a job that I have to drive 5, 6 hours. Okay, so don't drink your, maybe that around that time. But in a normal day, we have to make sure that we're hydrated, just like you said, that concentration and then irritation and then biofilm of the bladder. So can you talk more about gut colonization and how that might, like, what symptoms might that look like in a patient?
Mm. Yeah. So, okay, can I start in the sinuses though? Because I
Of
think that's
course.
important.
Yeah.
So, as we just kind of had a moment before our podcast here, we're both kind of clearing our throats, right? You realize that when you have stuff in your sinuses and you have postnasal drip, where does it go? It goes down your esophagus and into your GI. So if you have colonization in the sinuses, you're swallowing that multiple times per day, right? And where's that going? Into your intestines. The look you just made was great. Also,
I
I just
didn't
want to
even
say
think
from
of that. There was a sinus gut connection, but I actually didn't think, like, just how you say, like, you're just swallowing it into your
yeah.
gastrointestinal.
Yeah, and if you have, I mean, so the way the lungs work, especially if you're not a smoker, is you have these cilia that kind of pull mucus up from the lungs and the trachea and the bronchi, and then that also goes down your esophagus for you to swallow and have a bowel movement to get rid of. So that's just the way the body's designed, right? Like that's in its infinite wisdom. But at the same time, when it's loaded with mycotoxins and fungi, now we have an issue. And so then, if you have a biofilm in the gut and these, so okay, if you have colonization, you can have spores going down there, but then you can also have mycotoxins. And, because again, they might be fighting Staph aureus or something else in the sinuses and creating those chemical warfare, right? So then you could be swallowing those. And so then you're just kind of ending up with a lot of GI symptoms, right? And then we'll see things like, well, one of the big things is increased incidence of yeast infections, intestinal yeast infections. And so, as you know, like sometimes we'll do urinary oat panels on people, and there's a few markers there that we look for that have yeast. So, or mold. One of them is for yeast. And then we'll do the GI stool panels, and those will tell us if there's a yeast burden as well. But, dysbiosis, where there's imbalances in normal flora, inflammation. So that looks like, so now I'm telling you what it looks like on a lab. What it looks like in a person is diarrhea, gas, bloating, cramping. Yeah, kind of the IBS picture, I guess. What else do you see?
See, and I'm hearing, like, and I know you actually did a whole newsletter on this, the unresolved SIBO.
Oh, right. Yes. Yes, the
Oh my
SIBO
God,
that
how did we
that
hear
won't
that?
die. Yes.
That
That is
SIBO
true.
will not die. They've done like 14 rounds of antibiotics, and they've even done herbal protocols. And it's like, okay, well, it's not getting better because you actually have an issue with mold.
Right. Because you're reseeding, right? It's like it's coming down from the sinuses or up from the lungs. And so people with pulmonary fibrosis, mold is a thing to look at. They say, well, we don't know where it came from. Okay, well, maybe if you're a baby boomer, maybe it's Agent Orange if you're in Vietnam. Maybe you worked with chemicals in your life, but also mold can be a factor with pulmonary fibrosis.
That's a good point too. So we can see this. So far, we talked about how it can affect if it's colonized in the bladder, then you'll have that constant like interstitial cystitis, pressure, urgency, feeling
Irritation.
like, yeah, like you have an infection, but you don't. How many of these women are like, I have an infection and I have no infection and they're on antibiotics and they
Yeah,
don't have an
we're like,
infection?
okay, next time you go, make sure you ask them to culture and see if there's any bacteria. No bacteria. Here's your antibiotic. What? No. What?
Doesn't make any
No.
sense. It was so funny. I actually had that as my medical school clinical exit exam. That was basically the diagnosis that I had to come up with. And they wanted us to know that someone can mimic a urinary tract infection and it be interstitial cystitis. And they were saying what does that look like on a urinalysis versus what an infection looks like? So that's why I remember being like stressed as all hell trying to figure it out because we didn't, we heard of interstitial cystitis then, but we weren't seeing the amount of women that were happening, that come to us now with that. So, okay, so those are the bladder symptoms. We talked about the gut symptoms. We talked about pulmonary, how it can affect our lungs, and then also sinus. Now that's the last, like the sinus type symptoms.
Yeah. Yeah, so I would say it's mainly kind of a sinus congestion that doesn't go away. You could have dull pain on where your cheekbones are, even up like the bridge of your nose, around your eyes. You can have like a heaviness behind your eyes. Some people even get headaches, right? Headaches there, headaches behind the eyes. Actually, I've had people with temporal headaches. You know what I mean? Trying to think, basically you see those commercials for allergy medicine. That's kind of how those people feel, where they're like, the world is foggy, I just can't feel good. Now if we're lucky, they can get mucus out of their nose, or they can kind of spit it up, when they get it back down out of there, and we ask them what color it is. Now if it's bright yellow, I'm thinking it's more bacterial. In Chinese medicine, yellow is typically what we call a hot pathogen, and hot pathogens typically coincide with bacteria. And then if it's kind of that white gummy thing, or maybe it has a little tinge of green or black, then I'm thinking more mold, and that would be more of a cold pathogen, which again would translate more in Western medicine to a fungal infection. So even just looking at your mucus can be helpful to see what's going on.
Absolutely. How many times when you're like blowing out and you're like, what is it? What does it look like? You're trying to diagnose what's going on. And you're like, okay, this can actually help. And I love that it's a Chinese medicine principle because we learned that as, my mom used to always say that when we
Yeah.
were kids, she'd be like, oh, that's bacteria. It's yellow, but and you're laughing because the Dr. Sparks actually treats my mom. So God bless her soul. So it's in her, Long Island Italian New Yorker accent. She used to tell
It's
me,
like, be
okay,
still my heart.
you got bacteria in there, Sue. So I love it's like actual Chinese medicine principles
Yeah.
that can talk about the color. And then what would you say? So I know we said we can do sinus testing through the microbiology DX company, the nasal swab. We can do gut testing through the oat, which is organic
Well,
acid test.
that's still body wide testing, the oat, right? Because it's through the urine. But the stool testing through for the gut, yeah. Yeah, and then
Yes.
I'm
And oh,
just
sorry. And then actually, hold on. Sorry. I meant to say with the oat, this is what I actually clarified with you yesterday because I was interested about this. I guess what I meant to say in the oat, there are some markers, even though it's a systemic test that can check for multiple things in the body. There are some markers, right, that will help you determine if the mold is colonized. That's what I wanted to ask you.
yeah, like you said, you remember, so with biofilm, they're creating what I like to think of it as like a jello mold. You know what I mean? Like, you ever seen those from the 70s, like the Jello mold with like the fruit in it? Like the fruits, the
Yeah.
fungus, and the bacteria, and like nothing can get to it. Boom, just bounces right off, right? So that's how I visualize a biofilm, and I hate Jello, so it works. Um,
I actually loved that little that disgusting jello mix when I was a kid with the little fruit in it.
Gross.
Oh my
Oh, but anyway, so while chemicals can come out, they're not. It's not as much as like when you break it up, right? Then stuff can come out easier. So when something's in a biofilm and not just a colony. So a colony is like it's slaps growing on there, and the biofilm is like we put the Jello mold over it. So I guess that's the difference. When it's in a colony, you might see more of the organic acids from the molds, right? Because they're able to come out and get into the urine. Arabinitol is the one that we see that we is most correlated with yeast infections. But then there's citramalic acid and tartaric acid that are also fungal. So if those are high, then okay, there's something in the body we need to do further testing. maybe mycotoxin testing. If it's the yeast, then a lot of times we'll go into stool testing to see if it's the gut where this yeast is.
Okay, thank you so much for explaining that. So, just to summarize, if you want gut testing and you want to find out, obviously, what's going on in your gut from multiple aspects, from digestive function, immune system in your gut, parasites, if you want to do, for example, they do leaky gut testing in there, that could be a comprehensive stool analysis. Dr. Sparks like Genova. I like Genova too. I also use GA-MAP. But then if
Yeah.
you also want some systemic testing that the oat does has multiple benefits for the patient to look into their whole health, but they also have the section of the test that can help you determine if the mold is colonized. So basically, it would be a nice combination between a stool test, perhaps, and an oat test to be able to get more information about the patient. And then if we wanted to check their sinuses, then we would do the sinus type swab. There's nothing to check for biofilms in the bladder, right? I've never heard anything.
No, not that I know of. I mean, but then like we know that a lot of what we do is a clinical picture, right? So while we're thankful that we have all this functional testing, there a lot of times nothing's perfect, and it really is clinical picture. And you know, even with our treatments, there's not a lot of big companies with a lot of money willing to spend money to test our treatments. So really it's like going to conferences and learning from other docs what works, what doesn't work. So I don't know why I just got on that, but it's
No,
definitely
it's
it's important to
yeah,
know that
exactly.
like someone's experience as a medical professional is also important because they're bringing that to the table.
I know, I couldn't agree more with you because we're it's the same thing, like, when the test doesn't show that someone has something, but you still think that they do, you treat them as if of course, there are things that are more black and white, and you're like, "Oh, well, here's an example." I have a patient with acne who says, "I think I have high testosterone," because everyone who has acne thinks they have high testosterone, high androgens. We've checked the Dutch test, it showed not one high androgen, and then we checked serum to make sure. And there's no high androgens. At that point, because she's already constipated and she doesn't eat proper meals throughout the day and her blood sugar's not balanced and her HPA axis is not working, we now know with the lab testing, it's really not androgens. It's really not the one thing that someone thinks they have. Whereas if we know things like that are hard to come up on a blood test, like, or sometimes, like you said, there's a false negative when they're doing a mold test, we use our clinical judgment. Hey, you know what? We know these tests can be a little faulty. For example, the Lyme test, right? It's checking your immune response to an organism, not the actual organism. Or we know that if potentially something's going on elimination wise with the mycotoxin test, maybe it's not showing up. We would still treat, just like Dr. Sparks is saying, because we know that we have that clinical knowledge. And the best example of that is a patient who is in black mold. They had Hurricane Sandy around I don't even know. They live on like the water somewhere in Long Island, and Hurricane Sandy at the time came through, and they didn't think they had mold in their home. But again, he had Lyme symptoms, mold symptoms. I tested his markers that I normally do in the blood, like C4A and TGF beta and MMP9. They were perfect. Then he had a mold inspector come in, and there was 2 floors of black mold. So if we would have just determined, most of our patients have those markers when they have mold, but not everyone does.
Or one but not the other. Yeah.
Right. Yeah, so
Yeah.
I agree. You have to treat the patient, not the labs.
I think the other thing there that's important to say to people is also be a little weary of and we can get into it later, but the one-stop shopping, like one size fits all kind of mold treatments, like take glutathione in a binder, like uh-uh. Because everybody's different, and as you can see even with the testing, everybody's different and things come up, and so what you really are looking for is the person who has experience working with people and understands the differences.
Exactly. And like Dr. Tom, our mentor, would say to us, like, I remember him saying mold is a multi-organ system, just like Lyme is. Like he literally said to us, drain every organ. every organ is affected. So it's important that we're using those foundations first. And that's why your patients are getting better, because I mean, we just recently had patients who have had what we thought would be very complex cases, and we thought maybe could take over a year to maybe see movement. But we just saw recently someone, right? You just had just for a few little foundational things that you did with them in opening up their drainage pathways, we even saw their personality shine. It's like beautiful to see some of these people, not when their brain's not on fire,
Ugh.
they're like they start to like come out of that, because you're in like a fog when you have
Well,
this mold.
there's also a real thing that mold can make people angry. So and so that, as a practitioner, that can be challenging, right? Because you have this person who just seems angry all the time, and you're like, are they angry at me? And because we're kind of bleeding heart docs, right? Like we just want to help people, and so, but then as like you said, as the fire goes down in the brain, their personality starts to shine. So it's
Right?
really
And
nice,
it
yeah.
don't ever like think like, is my rage coming from, I mean, I had one patient, he said his rage was like next level, like red rage. And they were trying to tell him to go on psychiatric meds. And then they end up on all these psychiatric meds when they really, in fact, are having issues with their mold. So I also wanted to ask you, what can we do? Of course, working obviously with the practitioner to help specifics. And I also want you to talk about how you help patients in our VIP program that that we've been offering, but also then if you could share about maybe some take home tips of some products people can use if they wanted to just, let's just say, start working on their sinuses, for example.
Yeah, so that's kind of what we touched upon earlier, which is, if we know someone's exposed to mold and mycotoxins, we're just gonna do sinus stuff. Like, sorry that you got that for a year. So I tell people to do kind of make it as a daily ritual, your sinus protocol. So you can do either a neti pot with distilled water only, or a nasal lavage that you can get, at the pharmacy. That some you just kind of squeeze it up there, um, and you could. So Microbalance is a company that we love because their products are non-toxic and effective, right? So we use them a lot. So one of the things that I love is the citri drops. So for those who can see them, we got the citri drops. And you can put one drop of that in your nasal lavage or neti pot, and that will help. But still, it's important to do the nasal lavage or neti pot because you want to kind of get all the mucus out. So then things like the citri drops or a nasal spray, if you do a nasal spray afterwards, then are getting onto the surface of the area. Like, oh yes. So that's a homeopathic. I like that for people that don't like herbals, right? Because sometimes I have people that have sensitivities to tastes and smells, right? So the citri drops are great for that because they're homeopathic, so there's no real smells or tastes with that, right? And then I also like this one. Nasal spray is a propolis, so B propolis nasal spray. So, and a lot of these also are going to work on bacteria and fungi, right? So you're kind of getting a broad spectrum. And then you also use, well, I mean, I use it too, but you like the X Clear, right?
Yeah, I love Xlear. I feel like it's well tolerated. Some sensitive patients sometimes may benefit by doing Xlear first. It has xylitol. It can help break up biofilms and bacteria and fungus. And it has just like a nice saline base. And then just to
This
make
one
sure
has
we
xylitol too, I think.
Oh, it does
Yeah.
actually, yeah, I was gonna say that. I think so. Just to make a distinction, because they're both called Citri Drops, but one's called Citri Drops Dietary Supplement and one's called Citri Drops Nasal Spray. So the Citri Drops are the ones that Dr. Sparks mentioned that you can put in a nasal lavage or do a rinse with. And then Citri Drops Nasal Spray was the one with the xylitol as well as homeopathic.
So, and that's going to break up biofilms with the xylitol. And then the B propolis, and then there was the X Clear. Oh, and then I also like the Now Nasal Mist. That also has some good antibacterials and antifungal herbs in there. But that one might have a little bit more of a taste or a smell. So in my sensitive people, I don't use that first.
Okay, that's good to know. And then one
Oh,
other one I
wait.
like is just colloidal silver,
Yeah.
right? The silver nasal spray.
And then this is the sinus defense from microbalance. That what's nice about this is for people that cannot tolerate things in their nose, this goes under your tongue. So it's a homeopathic for under your tongue. So that's nice.
I was wondering why they created this one if they had that, but that may probably make sense because it's just an oral spray. Someone just asked me last night, can I spray this in my nose? And I said, no, you have to spray this in your nose, the Citri drop nasal spray, and this goes orally into your mouth, which is also homeopathic.
Yeah, and I actually got that crud that was going around New Year's, and all up in here, like nasal coughing, bleh, horrible thing. And I used the sinus defense spray and the Citri spray, both, and it's like, oh, I can breathe, So that was really nice for me to be able to have something to test it on.
That's great to know because I just got over the flu, but I have this like post nasal,
Use it.
like, causing that like annoying throat cough. So, okay, so since I'm the most sensitive patient in the world, Doc, would you recommend probably just like a spray, right?
Yeah.
Just instead of, because it says here for sinus symptoms apply, this is the Sinus Defense 2.0 spray. It says for sinus symptoms, apply 3 to 9 sprays under the tongue 2 to 3 times daily. So if you're sensitive,
I'll just do it once under your tongue. Yeah. Yeah.
perfect,
I mean,
amazing.
honestly, I did it once and then could actually breathe better. And when you breathe and you can actually feel it go through your sinus, like the air go through your sinus, that's what it felt like when I used it. And I was like, oh my God, so that was
And
great.
then that like feeling of like clear sinus is like the
Yeah,
best feeling in the world, right? Because doesn't it feel like, because when you have a sinus, it's behind your eyes and your eyes just feel really exhausted and burny and tired, and it's like even hurts to blink.
it's like, oh,
So yeah,
yeah,
I think you get that like puff, or one side is still more puffy than the other.
yeah. Yeah, so that was great to use. I also do home hydrotherapy for people when they're really resistant. So we have people put their feet in a hot water bath up until like mid calf, and then you can put cool cloths over your sinuses, and so that kind of is pulling moisture down out of the head. And so I do that, with people that need the extra help with getting stuff out of the head. Also, what do you call it, neck lymph massage, right? So you're helping to drain. So here we are like getting things out, but where is it going, so neck lymph massage can be really important. I have a YouTube video of that, so how to do
Oh,
that.
perfect. Put that in the notes so that they can view that. And yeah, and some people can even do alternating hot and cold over their, sinuses. They say, oh, do it 3 times, always end on cold because it's constricting to push stuff out. And I know every time I'm like, hey, my head is acting up, you always tell me, you always remind me, you're like, go put your feet in a bathtub of hot water and put something cold on your head.
Yeah.
So when you're your own patient, I'm the worst. I
No.
forget everything. I have a naturopath. I ask her the most heinous questions. It's like I don't even know where I get the questions I ask her. It sounds like I'm not even a naturopath, and it's pretty embarrassing. But we always have to consult each other when we're sick because it's very hard to treat yourself. And
Yeah, and your
we have
brain's
not.
not working, right? Yeah.
Absolutely.
Citri Drops is a powerful, all natural blend of citrus seed extracts, grapefruit, lemon, lime, and tangerine, designed to support your immune system with potent antibacterial, antiviral, and antifungal properties. The combination of extracts makes it harder for pathogens to develop resistance, enhancing its effectiveness. And Naturally Sue Wellness, we recommend Citri Drops for sinusitis by adding them to a sinus rinse or a facial steam. Our patients also use them for sore throats, cold and flu prevention, candida, parasites, gum health, and even cold sores. The best part? Citri Drops provide a non toxic natural way to support both GI and sinus health.
So one thing we didn't talk about yet is how you help patients. We got so wrapped up in sinuses that we forgot to talk about how you help patients in the Mold VIP package. So, can you share more about why we created that and how that can help patients through mycotoxin illness?
Yeah, so as you know, when people don't have chronic health issues, we can give them a few things and they're better in a month, right? But when you have things that you've had for years that are chronic, or you're dealing with something as complex as mold mold and or Lyme, it takes a while, right? Because we're trying to reverse that chronic illness state, and it takes the body wants to heal, so we just kind of have to give it the ability to do so, right? We need to support it, but it does take time sometimes. So I always talk about, Dr. Krista kind of has this peel the um layers of the orange kind of idea that she uses with people. And the big part is like you need to peel the peel off, and that's avoidance, right? And so that's the hardest thing for people, because it's usually either moving or remediation, right? And so it's really expensive. So that's where the mold testing plates come in, and or finding a good inspector, and then possibly doing remediation or moving. But then there's other layers, right? So foundations and protection, right? So foundations, you and I do with everybody, right? The foundations for good health. We call them the basics. Protection is really kind of working at diluting mycotoxins. So mycotoxins are fat soluble, so giving you a lot of like good fats. So Dr. Crinian used to say the key to pollution is dilution. So we're diluting these guys. We're using things like bioflavonoids to help get things out of the body. For example, a few of the mycotoxins. What's the persistent? Now, of course, I'm having brain farts and all these things. Gliotoxin, citrinin. I'm thinking of all the different mycotoxins. Ochratoxin, there we are. We call that one the persister because it binds to albumin, which is a protein in the blood, and makes it hard to get it out of the kidney because it's like too big as a complex to get out of the kidney. So if you use bioflavonoids, it actually breaks those apart and makes it easier to get the ochratoxin out. So a lot of times with people, if they're not on bioflavonoids and they have ochratoxin come back in their mycotoxins, I'm thinking it's probably higher than that. Like if it comes up like medium, like orange. So we need to do that. We need to support with the foundations. We need to protect. And then you and this is the part that I think, add on is the Dr. Tom aspect with the biotherapeutic drainage, which is drainage and elimination. So eliminating from the 5 major organs of elimination, but also working on the cellular level, like you had said, in every organ system. Obviously working on the organ systems that are being attacked first. Then we work on biofilm breaking and binding, repair cell damage, right? Mitochondrial repair, and then killing. And then a really big, important part that I'm adding at the end that's not on the original kind of orange thing is nervous system reset. Because, like, when you're chronically ill, it's a bit of a trauma. And your body and mind, it takes a toll. And it's really hard to get back to full mental good health when you've dealt with a chronic illness for so long. So that's a big part that, mind body, you know me, always got to go mind body. And then retest, do another test at the end there.
I love the whole process you just explained. That's super helpful to people because they're like, well, why do I need to do something for 6 months? Or like, why can't I just take a supplement and be better in a few weeks? It's unfortunately and fortunately, it's a process because what I'm seeing is people, they've gone through life not taking the best care of themselves. And then when they get sick, they expect to get better quicker with the natural medicine. I love that they're coming to us for natural medicine, but unfortunately, we always say, and we both say this all the time, it took a long time to get into this dysfunction. It's going to take time to get out. It doesn't mean to say that you're not going to have one symptom shift in 6 months. Like to feel the biggest needle move or the biggest significant shift, it could take up to a year, let's say, or 6 months for some. But within each month, as you and I do, we ask people their symptom. I think you do a symptom chart. I ask percentages just to have an idea. Is what I'm doing starting to move the needle? Do I need to go in a different direction? Do I hold tight and just stay there for a bit because I have a feeling they need this for a little longer? So I love how you've developed this process over 6 months because it's addressing all of these things so that they can actually be well ongoing, not just feel better temporarily. And this is going to then affect every other organ system because you're basically treating the person. It's just that you're putting a specific focus on the mold and being like, for example, what you just said was fascinating. So if ochre toxin came in, I would know I would need this, for someone else may not need that. Yeah, it would benefit them, but maybe not as much as someone else. So I'm really excited that you've been helping people through this package. And if you guys are interested, you can sign up for a 10-15 minute free consult with Dr. Sparks to see if she's a good fit for you. All you'd have to do is go to naturallysue.com and you can fill out a contact form. You can also text us or call us, and you can talk to my office manager, Megan, at 212-652-2240. And what else did we not to close? We had such good information in this one. Is there anything else you would say as last thoughts or anything we didn't add in? And we obviously are going to do another one coming up very soon as our part 2, and then another one after that. So we're going to decide based on your feedback what the best topics are going to be. So if you have requests for us, you can absolutely tell us what you'd like to hear more of, and we'll make sure to do more podcasts on those subjects.
Yeah, that's a great idea. I would say the one thing that I wanted to comment on that last piece that we were talking about with, doing a 6-month plan or a year plan is the other thing is follow-up is really important, because I'll find, and you've seen this, where you give somebody some supplements and then they don't call you for a year and they're like on that for a year. It's like, no, there are supplements that you shouldn't be on for more than a month. You know what I mean? Like, you're supposed to follow up. You know what I mean? Like, and so it can be dangerous not to follow up. But really, the bigger and most important part is so that, like you said, we're seeing like what needs to be tweaked to give you the best care possible.
Right. Or no, and you say this all the time, and I love this. When we ask you what you're doing, we need to know, not because we're judging you, because we need to know, are you not better, or are you better given that you've taken the things we told you or you didn't? And there's no wrong answer. I could see my patients getting like freezing a second when I say, well, did you take this? Just because I need to know. Because if you told me you feel 75% better and you took the thing, that gives me information. If you're saying I feel no better at all and you didn't take the thing, then I have no idea. Right. And
then
then
we're like,
we
take
know
the
what
thing.
to give.
Yeah.
Yeah. Then take the damn thing. Right.
Yeah.
We need to
Well,
know what to do next.
recently I've given a diet diary out to a couple of people, and I like beseech them. I'm like, please, when you fill this out, eat the way you've been eating for the past month, and don't just do a week of good eating. That doesn't help us. Like, how can I help you tweak your diet? Like, if I don't know what you're really eating? Because we remember we did that in med school, and our teacher was, we were all a little scared. Right? So we all wanted to impress her. And we were like, I ate only kale. It's like, it's like,
And we had to make sure our lunch was, when we had lunch near anywhere in her vicinity, we had like odd points lunches because we had to
yeah, she's
impress
an
her.
amazing doc, but she scared the heck out of
I
us.
love
And
her.
I remember once sitting next to her
Oh.
at lunch for at a conference, and I opened up my lunch pail and I was like, okay, what can I take out of this?
So
you know, I'm not having guac and chips today.
not today. Not today. Exactly. So you always have to be honest. If you feel like you have to lie, we're not. So how do I say it? We have to make you feel comfortable enough to, in a relationship between the practitioner and patient, that you feel like you can be honest. I think even if we do provide that space, people start feeling shame, like I should have done better. But
Yeah.
you need to not lie, because that doesn't help us. Because if we see that you are eating a certain way that's not serving you, then we can go into, and you know this, the mind-body part of it, where half the people, would you agree, if you had to say, at least 75% of patients know what to eat that's healthy, they just have emotional stuff behind it. It's that they're either feeding themselves food because they're maybe not feeling love in a certain place, or if their work is too stressful, or their family is too stressful, and they're eating, right? So now I'm doing, most of the time, these last few weeks, I'm doing EFT and tapping on patients for weight loss, because I'm not sitting there talking about what to eat for breakfast, lunch, and dinner, because we've already done that. They know that. So it's like, if you tell us the truth, we can help you. And Dr. Sparks specifically is amazing with mind body medicine. She specializes in this. besides mold, she had a lot of clinic shifts in our medical school with one of our another mentor, Dr. Dai, who is amazing mind body doctor. So we can help you break those feelings of shame or what's kind of keeping you stuck. So we want to encourage you to always be honest with your practitioner if you want to get the best results.
Yep.
Thank you
Okay.
so much, Dr. Sparks, for having this conversation with me today, for being here again. I'm so excited to do our next one next week. And if you guys have any questions, you can always send us a DM on Instagram. You can email our office.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.